Megan and the team are letting me go first. So it's on them. I'm the public contributor for RSS, and I'm part of the strategic oversight group at Southampton. And I'm going to give an overview from a patient and from a patient and public point of view of why PPIE is important. So, first of all, the idea that research is with and by us rather than to and for us, or them, comes from the disability movement, and it's a really kind of good blueprint to work from. That without us, you can't do research really, not health and social care research anyway. It relies on people. So an amount of thought about who we are and why we're there is important. Um, and we're all different. We all have different skills. We all have different ways that we might want to work. And there are things we can do and things that we can't do. So we have different needs as well. Um, and of course, everyone is a member of the public and a patient. All of you, at some point will be a patient, or a member of the public. You won't be the professional. And it's important to think about that, about who it includes. It includes all of us. And in the context of health and social care, it might include not just patients, but carers, charity workers, patients, as I've mentioned, and of course those people who know about their condition and who know about various aspects of working in research are experts by experience, which is worth remembering. And the other thing I wanted to point out was that if your research is about GPs, they're kind of your patient and public, really. So you might want to have a group of GPs as your PPI group rather than the public, although you might consider, dependent on your research, you might consider the public as well. But it's just important to remember who are you doing the research with and what's it about before you kind of set your PPI. And as I've said before, patients and public are experts in many things. Many of them have had a career or they have a career and they've got life experience of their own. And they might often bring skills that you hadn't even thought of that may be valuable to research. So don't just assume that we don't know anything. And don't assume that we don't know anything about your field of research, because we might. Um, and we might be experts by experience. And also listen to us, listen and find out what we might need to learn in order to be involved in research, and what skills we already have that we might be able to transfer or exchange with other people or with you. So who am I? This is just a snapshot of who I am. I was a curator. I decided to move into health, became an independent advocate, got an MSc in psychology, and I cared for my mother who had schizophrenia and dementia towards the end of her life. I wrote a blog. There's a link to it there, and for one reason or another, got conversant with some of these health conditions here. And I also got very interested in research, and here's some of the PPIE work I've done, including co-applicant on research projects and co-authorship on papers, and I've been a participant as well in various projects. So, what is PPIE in research? Well, that's a really good question. So a systematic review by Tricia Greenhalgh revealed that she found 65 different frameworks for PPIE. So it's a very broad subject, and it can be done in lots and lots of different ways, which you can use to your advantage because you can be inventive within the bounds of ethics and protocol, but you can be inventive in what you do. And PPIE full title is Patient and Public Involvement and Engagement. So what does this mean? Involvement is where you get the public involved actively in research projects, and I'll talk a little bit more about how that can happen. Participation is who you're getting the data from. So it's the people you involve to get your data. but there's still people with different skills and needs. Engagement is where you raise awareness of your work or you disseminate your work so that people, so that people can find out about what you're doing. And also, there's a new thing that's been introduced called community engagement. I mean, it's not new, it's very old, it's been around for a long time. But this is to go and raise awareness in specific targeted communities, particularly around inclusion. And that way, it's about broadening and diversifying the number of participants and people that you get involved in research. So it's a really important area, but it's not to be confused with public involvement. You do your community engagement to get your public involvement. And also, just to be really clear, with NIHR, unless you do PPIE, it's a mandatory condition for applying for funding, and it needs to be part of your research protocol. So here's an example of some of the experience that I've had of PPI. I first came across the notion of participation, actually, in this case, when my mother was diagnosed with dementia. She'd had long-term schizophrenia since the 1970s, and in 2012 she had this dual diagnosis, and she was asked to be involved in a project on long-term use of antipsychotics. And this, she didn't want to do it because my mother had terrible trust issues as a schizophrenic. But I got very interested, and I often go and look for this piece of research, but I can never find it. So who knows what happened with that. And then in 2013, I got a diagnosis of macular degeneration. It was very early. It was a very early onset. As a person who'd been involved in visual arts, this was a horrible thing to find out because I really thought I would be blind by now. But I was involved in a focus group where I found out about treatments. I never got any feedback. Don't even know if a grant was submitted on that. But I have found that over 12 years of treatment, I've seen the treatments change and also get better. So I know that research has had some impact to play on that. And then I've talked to you about a lot of work in particularly NIHR, but I also work more locally and regionally with the integrated care boards, and I'm on a clinical trials group. And I've also been involved in some co-production, particularly around advocacy, independent advocacy, and I co-authored a paper with Andy Pullman and Leanne Fenge around retention and recruitment in the social care workforce. So what about my experience of participation? Just trying to kind of draw out the differences. Um, I've been in this is three. I've been involved in about 5 or 6, but three different kinds of scales really. So one was just a 1 hour or 1.5 hour meeting where I completed a survey with somebody that also had some short interview questions. I found that really unrewarding. I suspect if they'd had PPIE involved, they wouldn't ask the questions in the way that they did, because it was a 3-part Likert scale. So it was agree, disagree, or not sure. And when you're being asked about what your experience was with your mother's GP, well, I've got quite a lot to say more than it was good, bad, or not so good, or sorry, good, bad, or I wasn't sure about it. And similarly, at the other end of the scale, I talked to somebody about complex mental health issues, and they were interested in the fact that my mother had the dual diagnosis. I gave an 1.5 hour interview about my mother, which I felt quite wrung out at the end of. And I did get a thank you, but I still don't know whatever happened to that research. And I felt like I invested quite a lot of my time and energy in that and didn't feel like I got very much back. And I'm involved at the moment in a study on living with diabetes and mental illness. And sadly, I was picked to go on the control arm, so I don't get any of the treatments involved. But it is an interesting study, and it's very caring, and there's a lot of feedback on that. So that's a good one. So some of the things, just to reiterate, lack of feedback comes all the way through this. And it's really probably one of the worst things that researchers do. They get to the end of their project and they forget to let their participants know what they're doing. So, for example, with the advocacy research, I sent out all the papers to all the advocates that, well, the paper that we did, and all the other researchers had forgotten. We do have problems with paywalls on accessing papers. So these, obviously that's a different matter. There's a variance on reward and recognition. Lots of the written material don't always have the things that we want on them. So again, more kind of more connection and collaboration with patients might have worked better. And that's just my, other patients might have other things to say. So moving on to the research process, this is the research cycle as kind of designed by a public contributor. And what she was trying to do here, it's Louise Ting. I sit with her on another committee, and what she was trying to do here was to kind of look at all the different places that patients and carers and public could be involved in research. And basically, it's all of it. We can be involved at any stage of the cycle. And what a colleague and I did for another talk, but it seemed appropriate here, was to think about all the different sort of stages. So we broke it down into design and approval, delivery, and making a difference. Now, patients and public tend to be involved a lot at the design and approval. So, participation in information sheet stage, looking at documents, lay summaries, that kind of thing. We often get heavily involved in that. And we're often involved at the evaluation stage, where we might want to talk about what's happened and maybe go and deliver the odd paper at a conference. But the actual delivery side, is kind of not really as well served. And I just wanted to give you a couple of examples. For example, I heard about a project that there were patients who were receiving dialysis, and I think it was about well-being and dialysis. And in fact, what happened was that other dialysis patients were trained to deliver the dialysis. If they were used to having it, they'd already had it themselves, and that significantly increased the well-being feelings of people who were in receipt of the treatment. So there's an example where people were trained, and people who are probably more qualified than others and had much more empathy to deliver their project. So have a think about what training can be done before you kind of dismiss it out of hand. And here's a whole raft of things that can be done. I'm not going to go through all of them one by one. It's in your booklet. But just, I mentioned participants' information sheets and lay summaries. Members of the public can get involved in the ethics and go on research ethics committee panels. And also they can help to define the questions. That often gets forgotten. In terms of the delivery, I think the biggest thing for me is that I do not understand why the public can't be trained to gather consent. And yes, you need lots of safeguards in place and you need to look at the ethics, but with the right consent training, the public might be the very best people to be doing that. And I've never quite got why that a lot of people say that's not possible. So have a think about that. The other thing I'd like to draw your attention to in delivery, think about patient-led and co-produced work. That project on advocates, nobody knew about advocacy, let alone thought about its inclusion in the social care workforce. So as a member of the public, that was something I was able to bring, and it actually strengthened the research as a consequence. And the other thing is that, bring the public in at the end, get them to kind of guide some of the discussions around evaluation. So here, Megan's going to be showing you a ladder of patient and public involvement. And I like to think of it as a spectrum, because you're probably going to need to do all these things at different stages of the work. It's not necessarily that one thing is more important than the other. So you're going to inform. That's your raising awareness. That's your engagement, going out and the exhibition stands and going out and talking about what you're doing. Consulting is getting people to look at pieces of writing and asking the question, asking about the questions and asking them if that's the sort of thing you want them to do. Involving is getting people a bit more engaged in the or involved in the research. It might be around delivery, it might be around dissemination, and so on. The collaboration is interesting to me as a patient. That's the point at which you start bringing people into co-design and work together with researchers on all different aspects of the design, delivery, and dissemination. And it might also be patient-led. I mean, that's what Empower suggests. But in fact, all these things can be empowering. I have found being a public contributor a very empowering process at all sorts of different stages. But yes, I love to have the opportunity to define questions and even considered, having my own project. So why do we have PPI in research? It's big, it's really great for impact. The relevant lived experience is really important. And of course, you as practitioners, I mean, this is particularly with my eye condition. The practitioners who deliver my eye treatment have never felt it. They don't know what it feels like. So they do listen to, when we experience pain, when we experience discomfort, and what parts of the processes work well and what don't. And the other thing is that I'd like to suggest that it's very important to have the public there to hold the research to account. Is it being done properly? If it's public research, we're spending public tax, we're spending taxpayers' money. Is it being done, is it being done in a cost-effective or efficient way? In commercial research, is it just being done the best it can be for public benefit? And often the public are the people who can comment on that the best. And then here are some of the benefits to researchers and public contributors. I've talked a little bit about what it's done for me. I've learned so much. And I've learned about how research works. I've learned about how to contribute, to this whole process, what the value of being a public member and the public voice can be. And on the other side, there are lots of things that researchers can find out. I've talked about experiencing pain and discomfort in various treatments, finding out more generally about lived experience. Thinking about things from different viewpoints and thinking about and sharpening up your communication skills. It's not just that we all have a reading age of 9. We all have different reading ages. Some people need pictorial, communication aids because they can't read at all, and then other people might want to read the whole paper. So think about the variance of people, and above all, what's the most valuable approach to working with the public? What's the best that you can do, rather than what's the least you can do to tick and how you tick a box? Because it shows in projects when that's done. And it will be said over and over again, I'm sure, in this session. Start really early on. Start even before you've started designing the project to work with the public, because you will get a much better project for it. So these are your UK standards for public involvement, and I really like this slide because normally you just get the 6 standards without any context. You have to go a bit deeper down to find those. But how can so working together, how can you effectively partner? These are questions you should be asking yourself. Communication tools, what do you need? For example, I mentioned pictorial ways of communicating for people who can't read. Find out who your potential stakeholders are and do the right kind of community engagement to go and find them and raise awareness to ensure that everything's inclusive and you have a diverse range of people that both as your participants and public contributors. Impact, think about how you're going to capture the difference made and how are you going to work with the public to make that happen. How are the public involved in your governance, and how do they hold you accountable along with all the other parts of governance that you have? And also this thing about training. How can you make your public involvement as good as it can be? And what support and training do they need to deliver it? And finally, I just wanted to talk about the NIHR and how they're working at the moment. They have just recently come up with 5 strategic commitment to working with public partners. So that's the equivalent of public contributors. And this is internal NIHR, but this is filtering into funding applications. So embed research inclusion. So I've talked a little bit about that, and I know that Becky Barnes is going to be talking about that more after this session. Strengthen partnerships. So what they're talking about there is a bit more around community engagement, diversifying your partnerships, work with community organizations, work with diverse individuals to make sure and work with them often so that you develop a relationship. Improve reward and recognition. If you can, certainly within your funding applications, make sure that your reward and remuneration satisfies the NIHR reward and recognition guidelines that you can find on their website. And above all, give feedback. Give an interim report on how you're doing. Tell us what's happened at the end so that we don't wonder for years what went on. And then the other one that I've been talking a lot about is strengthening capability and capacity. And again, that is about training people so that your offer on PPI can be so much stronger, and people's involvement can be so much more diverse. Don't just say we can't do it because they haven't got the skills to do it.
I've got a couple of slides at the beginning which overlap with some of the things that Helen was talking about, so I'll be really quick with these. But I just think it's important to kind of reiterate again the distinctions between PPI engagement and participation. And involvement, engagement, and participation. So really, I think the fundamental difference here is when we are working with patients or service users, members of the public, as active in an active partnership within the research process. So we're not treating kind of feedback or discussions as data. We're not analysing anything that they're saying. So we're not kind of using that information as we might with a qualitative participant. They're not passive recipients of information about research in the way that those involved in kind of engagement activities are. They're very much part of the research process and working with the researchers as part of the team. Again, I know Helen has shown you an example. She had her spectrum. I've got a ladder here, so it looks slightly different, but I think it's important and useful to think about how, when you're planning your involvement, where you're sort of at on this spectrum or on this scale. And as Helen said, none, they're all important and they're all relevant, but it does perhaps give you an opportunity to think about ways in which you could expand your methods a little bit to ensure you're involving people in slightly different ways or slightly more in-depth ways. You could also use them to sort of think about whether or not you've got the sort of frameworks in place to provide the adequate kind of training and resources to be able to support people at the sort of level of involvement that they are supporting you with. I think within the kind of NIHR funding process, there's not really a sort of expectation, as it were, as to what you would be, where you would be working at. Certainly there are some studies, I think every study is different and there's nuance, but there's some studies where, particularly in the kind of preliminary stages of developing your grant application, this level number 4, the sort of consulting, seeking feedback from patients and the public on research plans and findings, would be quite acceptable. But I think for the majority of projects, once you are thinking about your ongoing plans for public involvement and you're thinking about the delivery of your project and how you're going to work with people going forward, then that sort of level 3 involvement, which is about a much more sort of engaged embedded approach to involvement in the delivery of the research is something that an NIHR panel and many funding panels will be looking for. And this is the last slide where I've got overlap with Helen, but I also just, as she was saying, I think the research cycle is a really, really good thing and valuable thing to use in terms of thinking about the ways in which members of the public and service users can get involved in your research. So, we're going to be talking perhaps mostly around the sort of design and the development of grant research proposals, but within that you need to think about what your ongoing plans are, and for that you need to think about the whole of the research cycle and how are you going to embed activities and plan for ongoing involvement with PPI representatives. Some of these research cycles have kind of pointers and information that you can kind of reference in terms of each of the different stages, and that can be quite a good starting place for you to think about what an appropriate level of input or what some kind of ideas for your PPI representatives might be at different stages. So I'm going to move specifically on to some of the funders' expectations and the things that you will be asked to explain and discuss in the application itself. And certainly within an NIHR funding application, there's going to be two key areas that you'll need to address and you'll need to respond to in terms of talking about your patient and public involvement. Just to say, some of the NIHR funding applications are now starting to move away from the term PPI, and they're using the term people and communities. It is, essentially, it is kind of the same activities and the same principles that they're talking about, with just slightly different terminology being used, and perhaps slightly more inclusive of kind of community engagement and things like that. So if your application talks about people and communities, then this information here is still relevant. So the first thing that you need to be thinking about is around your pre-grant PPI activities. So anything that you've done in the development of your ideas or your application to help ensure that the research is relevant and is designed with input from service users to ensure it's acceptable for future participants of the research, for example. You'll need to be able to describe this. You'll need to be able to describe for this part of your application who it is you've spoken to. So who have you identified as being relevant to provide feedback on your proposal? Are they people with some lived experience of the condition that you're exploring? Are they a population who will be ultimate beneficiaries of the research? You'll need to consider whether you've spoken to people from a range of different backgrounds and offering different perspectives. And you'll also need to describe how you've worked with them. So have you met with an existing patient group at one of their sessions, or have you held one-to-one discussions with individuals? Do you have a co-applicant supporting on the writing of the application? Crucially here, you need to be able to describe the impact of those discussions and activities. So how did your work with patient representatives actually help inform the design of your grant application? So what was the feedback that people were able to give you, and how did you implement changes to reflect this feedback? For example, did patient representatives identify a barrier to recruitment, for example, or retention, which perhaps you haven't foreseen? And how do you plan to mitigate this? Have they possibly identified a different outcome measure which may be more of a priority for some patients, and have you been able to include this maybe as a secondary outcome or even replace your primary outcome measure? The other key area that you'll be asked to describe is going to be around your ongoing plans for patient and public involvement. So this is really about your PPI strategy. So should your research get funded, what are your plans to continue to work with members of the public, patients, communities to deliver on your research project? Again, you're going to need to be able to describe who it is you're going to be working with and how. So you'll need to consider things like the diversity of ongoing PPI activities, and I'll talk a little bit more about that in a minute. But whether you're reaching out to relevant communities and ensuring your plans for PPI are inclusive. Often kind of conversations with your PPI representatives themselves can help you understand what's going to be the most appropriate model, because there's not a one size fits all. For example, some people will prefer to work as part of a kind of like an advisory group and work in a team. and kind of come together throughout the course of the study, whereas for some other people or populations, the kind of formality or commitment of providing ongoing support may be a challenge. So it may be that you have to think about how you get ad hoc and occasional input from various different people, perhaps taking a community engagement approach. You might also work with people on an individual level. They don't necessarily have to join a group. So there's a kind of range of different models and ways, and it's really about thinking about what's the most appropriate in the context of the people that you're working with and the context of your project. It's really important to think about the roles of your PPI contributors. So, for example, it's not really good enough to say that you will have, for example, a PPI advisory group that will meet every 6 months through the course of the research and help deliver on the project. You need to be able to pinpoint exactly what they're going to be doing and how they're going to be supporting. So at this point, you can refer back to the research cycle for kind of relevant and meaningful roles for contributors. And it can be useful to look at something like your Gantt chart, perhaps, and consider at which points of the delivery of the research do you need to be working with public partners in order for them to be meaningfully contributing, in order for your research to benefit from their input. There is specific guidance around the roles of PPI co-applicants from NIHR, which may be useful to look at. Specifically, it's important to remember that a PPI co-applicant does need to have a defined role. By definition, co-applicants have some responsibility to deliver on the contracted research project, and a PPI co-applicant, that's the same for them as well. So they need to have some meaningful role in that. It's absolutely not essential that you have a PPI co-applicant, and there are some public contributors who prefer to be, even if they are working in that kind of high level in-depth way with you, they do prefer to be listed as collaborators, for example, because depending on the host institution, this can potentially be less burdensome in terms of contracts and tax implications and things like that. And lastly, we're going to talk about costs a bit later on, but you need to think about the costs and making sure that you've got a budget line for that and that you're adequately setting the costs for your PPI activities out. So I want to spend the next bit of my presentation thinking about some of the practicalities of setting up and kind of getting started with some of these PPI activities. And I'm aware there'll be lots of people on the call who've done lots of PPI work and are really familiar with the process around this. But as RSS advisors, we find this is one of the things that lots and lots of people kind of ask us questions about and sort of struggle to conceptualize, I guess, how you actually get started with some of these things. So, the first consideration that you need to make is around who should be included in your public involvement work. So I reflected on this a couple of slides ago, but it's really important. And I think one of the best things that you do here is just to think about who your population are and who are the end beneficiaries of your research. So, are you going to be recruiting participants for your research? And if so, what is the population you'll be recruiting from? Or is your work focused on a very sort of general intervention that's going to have kind of general population application? All of these things can kind of help you make a decision as to where and who you need to be talking to in order to ensure that you're speaking to people with the relevant experience. Just as an example, for example, if you're doing a project with COPD, it's very likely you're going to need to get the views of people who have had that lived experience. So people living with COPD who have kind of an insight into the challenges and the issues that face them as patients. You might also potentially benefit from speaking with carers and people living with COPD. There are some groups that are not specifically considered PPI by NIHR. Now, I know Helen mentioned that you might want to seek input from sort of GPs and healthcare professionals, and that is absolutely right. Depending on your research, that may be a really, really relevant area for you to get some input from. But from an NIHR perspective, that wouldn't actually be considered PPI work. Doesn't mean you shouldn't do it, but it would just be kind of broader stakeholder involvement. Still very relevant, but just not kind of branded as PPI, as it were. Okay, so something that's really, really important is thinking about inclusivity and diversity when considering PPI. Becky's going to be with us later today, and she's going to talk in a lot more detail about EDI or research inclusion as a whole, and also in relation to PPI. But I did just want to reflect on this for a moment, because it's so important to recognise how ensuring diverse perspectives in the design and delivery of research can help ensure that, you know, the research that we do is more relevant and accessible and appropriate for the whole population. So yeah, I mean, you know, it's well known that many marginalised groups who are less likely to be able to or know how to be involved in participatory activities like public involvement are often the same people and communities who can have kind of worse health outcomes. I think one of the challenges is that, you know, if we're not including voices from underserved groups in PPI, then that means things like, for example, recruitment may be less representative, and studies would be designed in a way that makes them accessible to some populations and not others. So interventions may end up being tested in non-diverse populations. And this in turn means that, you know, changes, improvements to health services might actually end up reinforcing health inequalities. Sonia's talking after me. She's going to be going into a bit more detail about how taking a community engagement approach can help you work with people from kind of a range of different backgrounds. And she's going to be talking about a model that we use at the RSS in Southampton, just as an example. So the next kind of practical consideration is around recruiting and setting up an initial meeting. So one of the first things that we recommend researchers do is explore whether there are any existing groups, and if there are, you can kind of reach out to them. So to use the COPD example I raised earlier, there's patient support groups for people living with COPD run by a number of different charities, so including groups like Breathe Easy. One thing that you can do is reach out to these groups. They often have a secretariat, they often have kind of regular in-person meetings, and you can ask if they would be happy for you to come along and discuss your research with the group. I think it's really important that if you are doing this, you need to think about doing it in a way that is that considers kind of reciprocity and is ethical. And, you know, we've already heard Helen talk a bit about how frustrating it is as a participant if you don't get feedback from researchers. And I think the same is true for kind of PPI representatives. So think about how you go about doing that and making sure that you're sort of closing the loop and you're kind of working in partnership rather than sort of dropping into these groups and taking and then not engaging with them. Same goes for community groups, and these can also be great if you're looking for a kind of broader public perspective, or if there's a particular kind of population that you're kind of looking to get input from. It's worth linking with an RSS. So in Southampton and Partners, we have a database of people interested in supporting PPI activity, and the RSS hubs across the country will all have kind of different mechanisms and ways in which they can support you. There are a number of kind of existing PPI groups, and I'm sure there'll be some kind of local to you. Some of them are kind of condition specific, so they might be useful to tap into. Some are non-condition specific, so are sort of generic. I guess it's worth being mindful with these groups that if your research is on a specific condition or a specific area, then these groups might not have direct lived experience. So just something to consider. The other thing that you can do is if you're clinical, you can possibly like put up some posters or hand out leaflets within a clinical setting. So you don't need ethical approval to do this, but you will need permission from wherever you're doing this, and you will need to ensure that you're doing this in an ethical way. So, for example, not asking people on the spot if they want to kind of provide you with some PPI input, or if they want to meet with you to discuss the project, but give them a little bit of information, you know, something that gives an overview of the project, how you're asking to people to contribute and payment, etc., and your contact details, and ask them to get involved if you're if that's something that they're interested in. And then kind of given the the patient population that you're working with, think about what would be the most appropriate kind of format for a meeting. Would it be one-to-one sessions? Would it be an online session? Could you do face-to-face? Again, all of these things are kind of dependent on your project and dependent on the people that you're looking to work with. In terms of running a session, I think it's a really good idea to have a rough agenda and have some areas that you know you'll benefit from input on. But it's also really important to allow for flexibility. People can come up with things that you haven't considered, or sort of conversations can kind of go in a direction that perhaps you hadn't anticipated, but can be really valuable. These are members of the public that we're talking to, so it's really important that you're using plain English and you're really clear about roles and expectations, and they're there as sort of advocates for other patients and to help think about your research project, not necessarily to kind of, they can reflect on their own lived experience, to talk about their own lived experience entirely. Facilitation skills are really important, so just be really mindful, particularly in group sessions, of kind of quiet people and being able to ensure that everybody has an opportunity to talk if they want to. Worth considering if anyone's going to be taking notes. You can, with permission, record PPI sessions. I don't know personally whether I think it's the best approach. I think generally speaking, you're trying to get a kind of overview and a feel for the sort of key areas of change that might be needed or input, and you don't necessarily need kind of verbatim records of that, but it might be something that's appropriate. So those are things to consider. And also, initial meetings like this can be a really good starting point for thinking about future collaborations and for involvement. So this last part of my talk, I'm going to be giving a couple of case studies. I think that it's quite useful just to see a couple of examples of the ways in which patient and public involvement work has been kind of initiated and started in the development of grant applications. And hopefully these are slightly different, both of these. So it kind of gives you an example of how taking a different approach is important depending on the study. So the first project here was a funded NIHR public health research project. I was a co-applicant on this study, so I'm kind of really familiar with the way in which we did the PPI, both in the lead up and during the delivery of the project. The title is a bit of a mouthful, so bear with me. But the title was Gateway, a randomized control trial, economic and qualitative evaluation to examine the effectiveness of an out-of-court, community-based gateway intervention programme aimed at improving health and well-being for young adult offenders, victim satisfaction and reducing recidivism. So I thought I'd do a PICO just because it gives a kind of nice, very simple overview of what the project was about. It was a randomised control trial. We were partnering with Southampton Police Force, Hampshire Constabulary. The population was young adults 18 to 24 who had committed a crime, been charged with that crime, had accepted responsibility for that crime. The intervention was called Gateway, and it was a 16-week programme of support, and this was delivered through a charitable organisation, and they had kind of mentors and group work. So there was kind of one-to-one sessions and group work, and the idea was that it would kind of support the young people to kind of rehabilitate or support them to engage in education or health services or whatever it was that they needed. The control arm was usual care, so that would be sort of going through the court system, and the outcomes that we were looking at were self-reported health and wellbeing measures, so that included things like drugs and alcohol use and also mental health, and we were also looking at recidivism rates at 5 years. So before we sort of started undertaking PPI work, we kind of knew there were a few things that we needed to understand to help inform the kind of the methods and the plan for the research. And some of those things were barriers to recruitment, so potential barriers to recruitment. We knew this would be, there's a lot of evidence that recruitment rates in this population can be challenging. So we wanted to kind of think about how we could mitigate that as best we could. We wanted to make sure we were capturing the right outcomes, and we were capturing outcomes that were relevant to people. We wanted to understand what the main concerns would be for the young adults taking part in the study. And we wanted to know the best way to kind of share information to study participants. So Hampton Trust was the organisation who had sort of developed the Gateway programme. It was something that they're a charity organisation that work with young people who are sort of have been involved in the justice sector, and they'd developed the Gateway programme, and they were actually already running something very, very similar. So what we kind of coordinated with them, and we spoke quite a bit with them about what approach we ought to take, and decided that the best thing to do was not to try and bring people together for a separate PPI meeting, because a lot of these young people had kind of quite chaotic lives and wouldn't necessarily be kind of in a position to sort of come along to additional meetings they didn't need to, and things like that. So we decided, myself and a colleague, we went along to to a couple of sessions. We went to 3 sessions in the end, of a similar programme that the Hampton Trust was running with young people. And at the end of the session, they basically said, we've got a few colleagues from Southampton University here who'd be really interested in talking to you about a research project. If you're interested in sticking around and talking to them, it'll take about an hour. You'll get a voucher payment for your time. If you don't want to stick around, that's absolutely fine. Feel free to leave. And on each of these 3 meetings, we were able to have some really good conversations with a handful of young people. So some of the key feedback from the discussions that we had. So the young adults that we were talking to felt that outcomes around mental health and well-being were really, really important, and that was absolutely important that was included in our in the information, the data we were collecting. They were also interested in outcomes that were perceived to have a tangible benefit to their lives, so things like employment or housing status, and they were keen for us to kind of include kind of things around that. There was a huge, probably unsurprisingly, but there was a huge amount of distrust for the police, and a significant barrier to recruitment was this idea that the university team and the police, as we were kind of partners in this research, would be sort of seen as interchangeable. And so as a result, we as a research team, we had to think really carefully about we consulted PPI representatives on this, but think really carefully about how we could kind of ensure that we were seen as independent and kind of had a sort of separate identity from the police, and the kind of recruitment process needed to perhaps move away from originally it was going to be done by the police. So it was really about kind of thinking about how we have our own identity and how we're not seen as as interchangeable with the police. There were some really interesting issues raised that we hadn't really considered around the location of data collection meetings. So the plan was to do kind of follow-up questionnaires and things like that in the community with participants. And we had feedback from a number of young adults that they wouldn't travel to different parts of the city, and that wasn't because of sort of logistical issues around travel, but it was because different areas may have different I suppose gang related or sort of postcode related issues with other parts of the city. So there were kind of, some young people who would not travel to certain other areas. So that was something we really needed to consider, and we needed to make sure that we had a range of different options in terms of offering spaces to do kind of data collection meetings. And privacy was a huge issue. So things like being concerned that information could be used against them. Particularly, we were collecting data around drugs use, and whether that could be not anonymised and shared with the police. So, really important for us to think about how we talk about GDPR and kind of data protection and things like that. They also felt that leaflets and written information about the study would not be considered accessible. In terms of our ongoing plans for involvement, we this kind of fell into three kind of broad categories. So the first was service user involvement, and we had a PPI collaborator who worked with us at a kind of strategic management level. He identified himself as an ex-offender. He was now working as a kind of peer mentor for other young people who were involved in the justice system. But he was able to kind of come in with a sort of he was able to commit to kind of regular meetings and come in with a bit more of a sort of strategic overview and provide input at that kind of high level. We did also continue to do a lot of ad hoc involvement with young adults with the support of the charity Hampton Trust, and we went back and forth with them, and they helped advise on multiple different things within the study throughout the course of them. We felt it was important to have victim involvement, so we had another PPI collaborator. So this was a woman from a charity that focused on supporting victims, and we also did a range of community involvement, which was focused on kind of consultations with community groups to understand the public's views on the interventions, and a lot of this focused on thinking about dissemination and kind of how we communicate some of the benefits to the broader public of doing this sort of work. So I've got just one more case study I'm going to whiz through, and hopefully this gives you a bit of an example of how a slightly different approach can be used. So this was a research project that we supported within the RSS. I have permission to share this information and the PPI work that we did from the team. It was an application for NIHR Health Technologies Assessment. And the title was a randomized controlled trial of serial prophylactic exchange blood transfusion in pregnant women with sickle cell disease, aiming to improve maternal and infant outcomes. So briefly, just the PICO for this one. So we were, the research team were looking to recruit pregnant women with sickle cell disease. As you can see from this little infographic here, sickle cell disease does disproportionately affect people from certain ethnic minority backgrounds. It was also a randomized control trial, and the intervention was giving preventative blood transfusions, so kind of regular transfusions throughout the course of the pregnancy, whereas the control arm usual care was transfusions just given in emergency, so for example extreme pain. And the outcomes that the team were looking at were a range of maternal and infant outcomes, so including things like maternal mortality and infant birth weight. So the team had done quite a bit of work in this population before, and they knew that there were some challenges to recruitment, so they kind of really wanted to build on what they knew already and think about how they could overcome some of the challenges. Again, they wanted to talk about outcomes and whether they were capturing the right outcomes. There was concern that the study would be very burdensome on participants. People would have to travel to London for the transfusions. They can take a very long time. They can make you feel quite unwell afterwards. So if you're doing this on a kind of regular basis as a preventative measure, what's the implications in terms of kind of work and things like that? And they wanted to know what people kind of thought that were the main safety concerns for people in terms of the study. So this research team had a PPI co-applicant that they'd been working really closely with on a number of other projects, Janine. And Janine is a sort of patient advocate who has sickle cell disease, and she's really heavily involved in a couple of different research projects and is a brilliant advocate for people living with sickle cell disease. And she also has links in terms of things like kind of forums and patient groups and what have you. So Janine agreed to come on board as a co-applicant in this research study, and she circulated some information around a kind of closed Facebook group that she's a member of, and identified a number of women who had sickle cell disease and were either pregnant or had had a child. They came from all over the country. So the meeting was held online. That just was more appropriate in terms of the context of this particular study. The key feedback from the meeting was really, really interesting. So PPI members talked quite a lot about the role of wider family members and how some family members might be against transfusions, and the kind of influence and importance of kind of ensuring that family members' views are kind of considered and that they also have information. They asked for additional information to be included, which focused on more on sort of infant health and quality of life measures. So those were included in the outcome measures. And there was real concern that the study was going to be a significant burden on participants. So they gave some recommendations around kind of using a flexible approach to scheduling transfusion so they could be coordinated with other appointments. And they also helped to identify kind of a number of ways that we might, for the purposes of the study, consider trying to alleviate some of the challenges for people. So thinking about supporting people's childcare and childcare costs and things like that if they were to take part in the study. So they gave us a lot of suggestions to think about. They gave the team a lot of suggestions to think about in terms of kind of trying to overcome some of those challenges. So Janine was the co-op for this study. So the ongoing plans, she kind of joined the research team, and her role was to kind of coordinate all PPI activities. She worked in partnership with the wider research team. The PPI group that met online for that first session kind of met a couple of other times before the grant went in, and agreed to continue to support on the research project once it was funded, and it was also broadened to include family members because it was really felt quite strongly that family members' views were important. This particular group was then they were given the role of kind of helping co-create information videos and leaflets, and some of them agreed to kind of actually be in the videos so that the videos would be made up of real people who had sickle cell disease. And they had a role kind of written into the application around leading on disseminating the findings to public and charity audiences. So hopefully those two examples give you a little bit of a kind of snapshot as to the a couple of potential ways that you might go about kind of identifying and starting to do a little bit of PPI work in the development of a grant application. Again, to reiterate, it's really sort of dependent on your project, and your approach will need to be nuanced and will need to be kind of relevant to what you're doing and to the population that you're working with. So there won't be a one size fits all, but hopefully that just gives you a few examples. The next presentation, you're going to be so fed up with me talking. The next presentation was going to be by my colleague Judy, but unfortunately she's unwell today. It's just a few slides around funding, because again, this is a question that we get asked a lot. So I'm just going to quickly whiz through these on her behalf, but they're not going to be very detailed, I'm afraid, before I hand over to my colleague Sonia. So just really to kind of say that it's really important to consider costing for PPI and funding applications. So this is something that the funding body will review, and they'll cross-check with the activities. There's no sort of set guidelines in terms of the amount of money in total that you'll be expected to spend on a research project. It really just depends on your project, on the level of PPI activity that you're doing, and the involvement that you're planning with the people or with the communities that you're working with. So it's very difficult to give a direct cost, but it just has to be proportionate, I guess. And some of the costs that you need to consider. So time, there isn't actually specific direct guidelines around time, but there is kind of recommendations from NIHR that £25 per hour is the amount that they pay. You could choose to pay your PPI representatives more if you wanted. It's just that is a kind of, I guess, a guideline from them. If you're asking people to come to meetings in person, then travel expenses and parking need to be considered, things like venue hire and refreshments. If you're working with people who perhaps don't have much English language, then you might need translation services. If you are thinking about your ongoing PPI plans and having PPI members working with you throughout the delivery of the project, then thinking about courses and formal training, both for your PPI members and for yourself, really, really useful. As I was saying earlier, I think the kind of important thing to think about when costing for PPI is to sort of work backwards from your plan. So there's no set amount, but what you need to do is think first what your plan is, who you're going to be working with and what role they're going to have. And once you kind of know that, then you can kind of start to think about how much each of those activities is going to cost and think about what that is going to look like in terms of a budget. Obviously, that's not going to cover any pre-grant activity, so you'll need to think about identifying potential sources for funding. So it may be that if you're in an academic institution, your department might have some funding available for pre-grant PPI work. An RSS, all of the RSS hubs have some access, have some funding for funding available for pre-PPI, pre-grant PPI work that can be applied for. And I'll just talk a little bit more about that here. So we, within the Southampton and Partners RSS, we call it the Public Involvement and Engagement Resource. And this is what all of the RSSs call their fund as well. The process may be slightly different, the amounts might be slightly different, but generally speaking, it's kind of it's very similar. With us in Southampton, you can apply for up to £300, and this is offered as part of a kind of package of support. So we'll work with you with in terms of thinking about what your PPI plans are and the development of your application. And once you've put in an application form, a decision will be reached within 2 weeks of submission as to whether that money for PPI representatives payment is approved or not. And here's just a really quick snapshot that is probably something that's more useful for you on your handouts than looking at here, but just gives you a little bit of an idea of how the process for us internally, how the process here works. And it's kind of a sort of 4 stages that will either kind of result in your application being approved, rejected, or it might be approved but with some recommendations or some suggestions.
Hello everyone, my name is Sonia Newman, and I am one of the Senior Public Involvement Advisors in the RSS in Southampton. I'm going to be talking with you about effective community engagement and inclusive PPI, with a specific focus on one type of engagement approach for pre-grant PPI activities and co-production. So it's good to be reminded of the expectations when it comes to writing grant applications. So funders will expect you to demonstrate how your project will be meaningful and inclusive. And what I mean by that is meaningful in a way that is genuine and considered, and inclusive, making sure you're including a diverse range of people with lived experience, particularly those from underserved communities and marginalised groups. And securing funding isn't just about having a great research idea, it's also about demonstrating how your project will be relevant, inclusive and beneficial to the people and to communities. And I'm sure it won't come as a surprise to you that successful research isn't done in isolation. It requires working closely with people and communities, listening to views and ideas and ensuring that these voices are heard. Inclusive PPI isn't just good practice, it's important for research and making a real difference. Community engagement does involve raising awareness, but it's also engaging with people and talking with and hearing from them. And it's essential if you want to hear from people who wouldn't normally get involved. This will help you to be inclusive in your PPI activities and have diverse representation in your PPI groups. There are different kinds of community engagement approaches. And I'm really excited to share about our approach in Southampton called Community Conversations, previously known as the Listening Cafe. A key part of this approach is building trust, and the truth is this takes time and there's no quick way to do it. By building trust and meaningful relationships, voices are heard. And when you invest in the relationships, you create a strong foundation for sustainable collaboration, and people will feel invested in what you're doing. This is a photo which shows a researcher with some parents from the local community using the Community Conversations approach, which we did recently, to help inform their design and development. So what is Community Conversations? Well, it's all these things you can see in this word cloud. It's a food for thoughts model, offering a structured yet very informal way for researchers to engage with and involve underserved communities and marginalised groups in research. Informal conversations help to shape and strengthen funding applications, and you get to demonstrate this and highlight it in the relevant sections of your application form. For example, writing what happened, what people and communities said, what they told you, and how it's informed your application and the difference it's made. The principles of this approach is that meaningful conversations happen around food in the community. And when people come together in a comfortable, familiar setting to them, conversations can flow naturally. This makes research much more accessible and considered, and it creates opportunities for those who might not typically engage, so that they get a chance to share their experiences and insights. And thinking about the PPIE spectrum that Helen talked about earlier, this approach lends itself to the different stages from informing through to empowering. So we've developed a roadmap for our community conversations approach, and the principles of which can be applied to pretty much any community engagement. Firstly, you want to think about who you want to speak with and hear from. Identifying the right people and communities is key. So whose voices need to be included in the conversation for your research? Next, have a think about the community organisation you'd like to connect with. Partnering with trusted organisations really helps open doors, builds trust, and creates a space where people feel comfortable sharing their thoughts. Then it's about the organising, the planning and preparing. So having some meetings to ensure that the conversations, although very informal, still have a definite purpose, direction and intended outcome. These should be collaborative, and the organisation's input is actually important during this process, because they are the experts on their community, and their insights will help to shape a process that can work for everyone involved. And finally, thanks and follow-up. So closing the loop is so crucial. The people you are listening to and involving need to know that their contributions mattered, which Helen talked about earlier, and also Megan, that the feedback is vital really for, helping people to feel valued and heard, providing an update and showing how people's input has influenced your funding application. And it goes a long way to helping people feel valued and heard. In my experience, developing partnerships with family hubs has been key to meaningful community engagement. We've been building relationships with the staff and families here for about 6 years now, and around 4 years connecting researchers with people who wouldn't normally hear about or get involved in shaping research. And we've been able to demonstrate that we're committed for the long term. But it has required a lot of time and energy, but it's definitely been worth it. We've been advising, supporting and facilitating researchers to have community conversations to inform their funding applications through this way. But what's really exciting is that the impact goes way beyond these informal conversations. The relationship building creates ripple effects, and we've seen it spark wider interest and further involvement. So some of the people we've engaged with and facilitated researchers to involve have gone on to support research in other ways. It's raised their curiosity in research and it's increased their confidence. They've spoken with their family and friends in other areas who have also shown an interest in getting involved. So you really get a sense of the ripple effect here. I would add that a fundamental reason for their continued interest and involvement has been closing the loop and that feedback. They've told us they really appreciate when researchers shared the difference their input made and provided an update on their application or their project, and it made them want to get involved again. And more importantly, it helped to change their impression where previously they felt quite used by research. And in their words, researchers came, got what they wanted, then disappeared. We never found out what happened next or whatever, or whether what we said actually made any difference. So it's really important that communities need to see their contributions matter and lead to change. And when they feel valued and heard, it gives a sense of ownership and motivation. So just some practical considerations when engaging with and involving communities. So think carefully about how you communicate. Using academic language is often complicated and presents a barrier to many. I would say that the language and terminology you use matters a lot. Ask yourselves, will it make sense or will it confuse? And if in doubt, share with a friend who isn't clinical or academic. Be sure to use clear and simple communication so that everyone can contribute meaningfully. Flexibility is key. So rather than imposing a fixed research agenda, be responsive to community needs. For example, meeting people where they are and feel comfortable. And this might be in community centres or coffee shops or other familiar spaces. I mentioned a little earlier that we've seen some people who have been involved in community conversations go on to help with research in other ways. And instead of offering traditional and formal ways of getting involved, we've encouraged researchers to be adaptive, responsive, and offer different ways. And it might be as simple as changing the terms used. For example, using an ideas group or an advice group instead of advisory group, or offering a meeting in a community space rather than a formal online meeting or an academic or hospital environment. But access goes beyond location. Accessibility goes way beyond location. What about when English isn't someone's first language? Can you offer an interpreter, for example? Or if there are learning differences or lower literacy levels, is using text a challenge? How can you remove these barriers to involvement? Can you use more visual resources? Think about social anxieties, like the size of the group. So being sensitive and adaptable helps create an inclusive environment. And finally, reward and recognition should be meaningful. So not everyone wants a love to shop or an Amazon voucher. Grocery vouchers may be much more useful and appreciated. And certainly in the community conversations that we've been running, the members have told us that they had preferred grocery vouchers. They've been far more useful. So just some final thoughts to wrap up then. Community engagement and inclusive PPI strengthens funding applications, and it ensures that research is relevant and impactful. And as Helen mentioned, you can be creative and inventive with this. Inclusive PPI isn't a tick box exercise. It's built on relationships, responsiveness and trust, and taking the time to listen and adapt and genuinely involve communities. Community conversations is just one approach with principles that apply across any community engagement model. And it's a way to bring a broad range of diverse voices into the research process. And investing in these efforts ensures that research is not just done for communities, but with them. So just to say that there are a couple of useful resources to get you started. The NIHR has produced the Include Roadmap, which is about who you need to be involving, what you need to be thinking of, and Birmingham University have recently published a helpful step-by-step guide to inclusive research cycle, the how-to in getting going.